Can your posture improve pelvic floor health? Imagine standing tall and feeling confident, but did you know your posture can actually influence how well your pelvic floor muscles work? It might sound surprising, but your everyday posture plays a big role in pelvic health. The pelvic floor is a group of muscles that support your bladder, uterus, and rectum. These muscles work closely with your diaphragm, abdominal muscles, and spinal muscles to keep everything in place and help you control your bladder and bowels. When your posture is off, it can throw this muscle teamwork out of sync. For example, slouching or leaning forward while sitting reduces the engagement of your transverse abdominal muscles. These muscles work with your pelvic floor to support bladder control. If they don't work well together, your pelvic floor can weaken over time, leading to issues like urinary leakage or pelvic discomfort. Your spinal alignment matters too. If you have too much curve in your lower back, called swayback or lumbar lordosis, it increases pressure on your pelvic organs. This extra pressure can strain your pelvic floor muscles. On the other hand, if your lower back is too flat, your pelvic floor might not contract properly. The tilt of your pelvis also makes a difference. When your pelvis tilts forward, known as anterior tilt, it puts more downward pressure on your pelvic organs. If it tilts backward, called posterior tilt, it can make it harder for your pelvic floor muscles to contract effectively. Your upper back and head position also influence pelvic health. When you lean your head forward or round your upper back, it changes how your rib cage and pelvis align. This can interfere with your breathing. Since your diaphragm and pelvic floor muscles work together, poor breathing mechanics can weaken your pelvic floor activity. Good posture means sitting and standing with your rib cage stacked over your pelvis. This helps keep muscles at the right length and tension. When your muscles are in proper alignment, your pelvic floor can contract and relax smoothly. This leads to stronger muscles, better bladder and bowel control, and less pelvic pain. For pregnant women and those focusing on fertility, maintaining good posture supports the pelvic floor during pregnancy. It helps prevent dysfunction and speeds up postpartum recovery. Simple steps to improve your posture include avoiding slouching when sitting or standing. Gently engaging your core muscles supports your pelvis. Practice breathing techniques that coordinate your diaphragm and pelvic floor movements. Incorporate exercises that focus on aligning your spine and pelvis. If needed, consult a pelvic floor physiotherapist or fitness expert who specializes in pregnancy and fertility. They can help you find the right posture corrections and exercises. So yes, your posture can really improve pelvic floor health. It influences muscle coordination, pressure distribution, and overall function. Making small adjustments to how you sit and stand can strengthen your pelvic muscles and reduce symptoms related to pelvic floor issues. It's a simple, effective way to support your pelvic health every day.